Subcommittee will come to order. The chair recognizes himself for a 5-minute opening statement. First, I want to recognize the bipartisan bill that we were able to pass last week that included many important health care provisions and lowered health care costs for all Americans. Today, we will discuss health care costs and patient access challenges by examining affordability across the entire pharmaceutical supply chain. I am proud of this subcommittee's work, but there is still more to be done, which is why I'm eager to continue building on our affordability series with today's hearing that comes after we heard from insurance executives last month. We now will hear from stakeholders who are a part of the complex pharmaceutical drug supply chain. To regular people, this system may seem simple. A disease is researched and a treatment is developed. Then that treatment is manufactured and distributed to a hospital, pharmacy, or other healthcare entity before it is dispensed to the patient. However, there are many more layers that are involved in this process that affect how a drug gets to a patient and how the drug is priced. One of the most frustrating aspects of the supply chain is that it operates as if in a black box. Luckily, we have witnesses here to provide their perspectives and shine a light on the process. Do each of these entities in front of us today play a role in getting the drug to a patient? Yes. Are there too many cooks in the kitchen at times? Probably so. Today is a great opportunity for Congress to get a glimpse and see what is happening and look for ways to help make prescription drugs more affordable. 2017, the same subcommittee held a similar hearing to the one we're doing today, but a lot has changed since then. I'm glad we are re-examining what we learned from that hearing to continue working towards what we all want, lowering costs for patients while ensuring that America remains a leader in pharmaceutical innovation. We have pharma and bio in front of us who can speak to the intricacies that go into researching, developing, and pricing a drug on the market. We will also get the perspective of generic drugs from the Association for Accessible Medicines who can speak on the issues in that arena. We also have the Pharmaceutical Care Management Association here as the trade association that represents pharmaceutical benefit managers, commonly known as the PBMs. What we heard in our hearing last month is that insurance companies own many of these PBMs. In fact, the largest three PBMs are owned by insurance companies, and they control over 80% of the market. How they manage these benefits is a mystery at times and can lead, in some cases, to higher prices. However, just last week, led by Representative Buddy Carter from Georgia, Congress passed and the President signed into the law the biggest PBM reform package in history. These bills will bring more transparency into this system, lower costs, and allow for more access to medicines. The Healthcare Supply Chain Association is here on behalf of group purchasing organizations, or GPOs, which act as intermediaries between manufacturers and providers. In front of us is also the Healthcare Distribution Alliance, who is involved in the distribution of prescription drugs along the supply chain. I am looking forward to hearing from the National Community Pharmacists Association, who is also with us today, since they represent the community pharmacists that so many of us use. These community pharmacies serve a critical role in bringing care to patients, especially in rural areas, yet many have had to sadly close their doors in recent years due to some of the factors that we will discuss today. The ERISA Industry Committee is also here to discuss their point of view for employers when it comes to high costs, as well as decisions they make based on those costs. Each of these different entities play a unique role in how a drug finally gets to a patient. In this meeting, we will hear from these witnesses on how to navigate this complex web on behalf of the American people. I look forward to the discussion. And with that, as I said, I look forward to it. I yield back and now recognize the ranking member of the subcommittee, Ms. DeGette, for her 5-minute opening statement.
Thank you.